Assalamu alaikum and welcome dear neurosurgical residents who are preparing for neurosurgical exams. So if you have done reading your textbooks, so here we can revise and repeat some of the important topics. So today we will discuss aneurysms, very brief and some very exam related high yield pearls from the topic of the aneurysm. So let's begin. My name is Dr. Muhammad Haris Masood, and we will be doing aneurysms today. So, our first question is what is the most common site of an intracranial saccular aneurysm? PCOM or ACOM? And the answer is ACOM. So whenever someone asks you that what is the most common site of an intracranial saccular aneurysm, in the exam we will take ACOM. So what is the strongest modifiable risk factor for aneurysm rupture? Diabetes or smoking? So in this case it is smoking. Smoking, alcohol drinking, and hypertension. These are the three modifiable risk factors for aneurysm rupture. So our answer would be smoking. So I am. Let me tell you that I am very bad in videography and making films. So please forget that, okay, and don't mind. So our third question is cranial nerve, which is most commonly affected by PCOM aneurysms. So whenever a PCOM aneurysm is asked and a cranial nerve is asked, then you have to put oculomotor nerve. So this is the right answer. So Hunt and Hess grade 3 is characterized by Hunt and Hess is a grading system and it has four grades: grade 1, 2, 3, 4 and 5. Sorry, it has 5 grades. So whenever grade 3 is asked, it has confusion, lethargy and focal neurological deficit. So Hunt and Hess grade 3 is characterized by confusion, lethargy and focal deficit. So Fisher CD grading system predicts the risk of, okay, whenever we come across with the subarachnoid hemorrhage or aneurysm, so there are certain things that happen after an aneurysm or after subarachnoid hemorrhage. One is rebleeding, that is most common. Other is vasospasm, hydrocephalus, neurological deficits. So in this question it is asking that Fisher CT grading system predicts the risk of vasospasm or rebleeding. So the answer is yes, the answer is vasospasm. Fisher CT grading system predicts the risk of vasospasm. Okay, let's go to question number 6. So what is the incidence of cerebral vasospasm at which day? The incidence of cerebral vasospasm is highest between which days? So what would be your answer? The answer is 3 to 14 days. The drug proven to improve neurological outcome after neurological subarachnoid hemorrhage, aneurysmal subarachnoid hemorrhage, is nicardipine or nimodipine? Yes, the answer is nimodipine. The drug proven to improve neurological outcome after aneurysmal SAH. So in question number 8, if in the exam it is asked what is the gold standard investigation for defining aneurysm anatomy. So whenever the word gold standard is used, you have to take DSA, digital subtraction angiography. Berry aneurysms arise commonly from veins or artery branch points. So the answer is artery branch points. Which aneurysm site carries the higher association with oculomotor nerve palsy? So this question is repeated here. We have done it in the past question. Yes, you are right. Whenever third oculomotor nerve palsy, the association is asked, we will take posterior communicating artery. So guys, on our 11th question, it's asking increased ruptured risk of an aneurysm is associated with diameter less than 5 mm, diabetes mellitus, posterior circulation, or male sex. So the answer here would be posterior circulation. Most common cause of death after aneurysmal subarachnoid hemorrhage within 24 hours. Is it rebleeding or vasospasm? So within 24 hours, the most common death after aneurysmal SAH is rebleeding. Rebleeding rate is very high within first 3 hours, then after 6 hours, 12 hours and 24 hours. So we will here go for rebleeding. Question number 13, it says vessels which are most common involved in giant aneurysms, pica or ACOM. So the answer is ACOM. Giant aneurysms, ACOM. Preferred treatment for ruptured aneurysm is delayed treatment, observation or early surgical treatment. Yeah, it's early surgical treatment. Aneurysm recurrence after which, so it asks aneurysm recurrence is higher after clipping or coiling. Yes, it is higher after coiling. Recurrence rate is higher with coiling. So the most common cause of DIND, delayed ischemic neurological deficit, rebleeding or vasospasm. So delayed ischemic neurological deficit is associated with vasospasm. Okay, so question number 17. Sentinel headaches are sentinel headaches results from migraine or aneurysmal leaks. Yeah, the answer is mild aneurysmal leaks. Disorders associated with intracranial aneurysms are NF2 or adult polycystic kidney disease. So it is adult polycystic kidney disease. Most technically challenging location for microsurgical clipping is, so most technically challenging are those which are in the posterior circulation, so basilar apex. And one thing that you should always keep in mind, that the posterior circulation aneurysms are favorable for coiling. So whenever asked about coiling versus clipping, then and in posterior circulation is asked, then you will go for coiling. So what should be the definitive goal of ruptured aneurysm treatment? Delayed surgery or early surgery? Early surgery benefits more. Control of an hemorrhage and exclusion of the aneurysm from the parent artery. So this is the most definitive management. So we have come across around 20 important points in aneurysm management and in aneurysm surgery. So what for appearing in the exam, the candidate should also have a very sound knowledge of Hunt and Hess grading, WFNS grading, Fisher grading, modified Fisher grading, coiling versus clipping, and aneurysm and pregnancy. So these 6 topics we will inshallah make some important points of these, and we will discuss in the next video. Till then, take care, goodbye, Allah Hafiz, and keep on reading the textbook and repeating the MCQs. Thank you.